obesity medicine doctor in Georgia. I'm trying to work and empower my patients, and through avoidance of mass medicine mindset, I'm hoping to promote n equal to one medicine, which is nothing but one person at a time medicine. And that is only possible by empowering the healthcare professionals with understanding, and also simplifying healthcare delivery processes by making it easier for the patients to understand through people, process, and technology. And I'm trying to bring in some interesting case based approach to what I share through my social media content and YouTube videos. I'm located in Georgia. My conflicts are nothing but removing barriers to healing for infections, wounds, and obesity. And I'm working on telemedicine based solutions for that. My target is nothing but tsunami of chronic disease. So here we have a case of a 60-year-old pastor who is a diabetic with diabetes from 8 years, hypertension from 15 years with atrial fibrillation, and significant problems with sleep apnea and left knee, severe osteoarthritis, and with the recommendation that he go on for knee replacement. And he had issues with sleep apnea, and he was advised to lose weight. And his initial weight when he presented for evaluation to my clinic was 415 pounds on March 11th, 2021, and BMI was 61.2. And his weight on November 18th, 2021 was 354 pounds, and he has lost around 61 pounds when compared to his initial visit. I mean, his main target, end target, is 215 pounds, but Christmas target is 325 pounds. And his reasoning for weight loss is because he wants to do more better, dress better, and also make sure that his leg pain and leg swelling and blood pressure improve. So here we have a lab work. His hemoglobin A1c on March 23rd was 6.3, and his fasting insulin was 26.4, C-peptide 2.10, and triglycerides were 73 and HDL were 50. If you see here, this triglycerides to HDL ratio is good, but that is classical of African American gentlemen or African American genetic heritage. But if you see here, his lipoprotein little a was 156, which is elevated. Normally, that is thought as not being changing much with diet, but you see there's a slight improvement here. His LPIR score, which is an indicator for insulin resistance, was 35, and over time it has come down to less than 25. His hemoglobin A1c by October 13, 2021 was 5.9, and fasting insulin has come down to 21.4, and C-peptide is down to 1.74. And what we have done is by July 2021, we got body composition analysis that we did with bioimpedance testing. And if you see his basically his weight is from his initial weight in March was 415, and now it is down to 354. So 61 pound weight loss. And if you see here, his body fat mass has reduced, and his excess body fat mass is also down, and his BMI is remarkably improved from 61 in the March to 52.3. And his the right way of improvement of his weight has made sure that his BMR metabolic rate is still stable. So, but he did lose some lean body mass. So he was encouraged to do body muscle mass improvement or weightlifting exercises or band exercises. We'll give you a patient perspective video on uh, opinion as to what happened and how he essentially improved himself. So here, um, thank you, Arthur, for coming again. This is our second interview. So tell me, how are you? So tell me about your original journey.
Well, my original journey, I came in at 415 pounds. My pulmonary doctor told me to come in. Well, basically, I came in because I was overweight. Mm-hmm. And he had told me, lose weight and I would help my breathing. Mm-hmm. So I was referred to you. And when I came in, basically I was trying to help my, get my breath up because I had, prior to that, I had COVID. Mm-hmm. And, well, the journey has been good. Mainly, you pointed out to me, you said you could help me mm-hmm. stay alive if I just follow your instructions. And quite obvious, I definitely want to stay alive. Mm-hmm. And right now, again, I went on the fasting. Mm-hmm. I started out with the fasting, just eating 6 hours a day. And that was doing
in a 6-hour window.
In a 6-hour window. Mm-hmm. I was going from 11 till 5.
Okay.
And but I started realizing, I said, well, I need to go. I was eating a little too much, so you told me, so just start cutting down and just go some days as long as you can. Just
like
eat one meal a day.
Fasting like Jesus did. You're a pastor.
Yeah.
So.
Well, I ain't made that point yet, but I'm on my way. I'm down to one meal a day within that hour. But like I said, I used to eat around about 5 or 6 in the evening, but that's just one meal.
Okay.
And I drink my 3 liters of water a day. Mm-hmm. That's one thing that keep me busy. Mm-hmm. Every time I get a little hungry, I go and drink a glass of water.
Okay, cool.
And that get me through.
Did you know Shaq got his 6-pack by doing low carb diet, and you can do better because you have done already better because you kind of reverse your diabetes. So when you came to me, you were diabetic and you were 415 pounds, and this was around March 11th of this 2021, and then. Remember, we did not have the body composition machine, and when we had this body composition machine here, so we started doing you were 415 pounds in March, but then when we started in July, I think we got the body composition machine. You were 371 pounds. You started going down dramatically there by then, mm-hmm. But then when compared, so. Your fat mass when we checked the body count with this one in July was excess of 163 pounds. So now you lost around, from the beginning you lost around 61 pounds, but you lost around 9 pounds of fat, but also there is, like, remember, you're doing fasting and all. You lost some muscle too, and since then you started doing some muscle strengthening exercises, and you did have some significant problems with the knee pain. How is your knee pain now?
My knee pain, every now and then, I kind of over exert where it give me pain where I have to kind of slack up the next time. So my exercising, is kind of down because of my knee. But as you point out, I may have to wear a brace.
Okay, I'll order a brace for you, and you can put the brace on, and then try to do the thigh strengthening and leg strengthening exercises that will increase your risk. I mean, before all this, you told me that your orthopedic doctor said you might want to have knee replacement.
Right, absolutely. And that's one thing I didn't really want to do. Basically, that was before I come to you. Mm-hmm. And I said, well, if I'm going to lose basically weight, I said, let me see how it works out. So at this point right now, it's better than it was then, because when I came in here at first, I had a cane. And I don't need no cane, but at the same time, I still have pain, so I'm getting better. So I'm going to use the braids, and that braids might help me strengthen it even more. Well,
yeah, I think you might want to get in and do some like swimming exercises and some like leg pushing, the leg thigh strengthening exercises, and that will kind of help you. Okay, so compared to lifestyle wise, are you feeling good with what you're doing?
Oh, I'm feeling much better. I can get out and do more walking, as far as going to the grocery store and going. I don't do that much shopping, but I do get out and go to the shopping center and just walk back and forth and look. But I can do more now.
So we need to we still. So you almost like popped out a 61-pound baby, and then the question just comes down to, there's a lot more to go, but it just comes down to you persistently taking this as a lifestyle. So you are another success for me for having helped diabetes reversal. Yes, you still have metformin on board, but I think that is more so to help you with improvement of the rest of the other issues. And I think over time, we can even get off that. So I'm not worried about it. Your hemoglobin A1c is normal, like 5.9. The last time we did it in October, and I think you are a remarkable success. And I think you just have to make sure that this has to be the newer lifestyle, and you cannot go back.
Right. Well, one thing you point out to me when I came in, you said I was carrying a man on my back. At 415 pounds, and they said I need to get the man up my back.
Yeah.
You just said I popped out a baby. I still got another half a baby left, because I don't have a full man. So around 100 pounds, I figured that'd be close to being a man.
And the skin is also better.
Right. I've been using that cream, and
the skin is also better. Overall, the skin is better. The weight is better. You're a happy man. Keep pushing. But you're a preacher too. Feel free to teach it in your things, and encourage and educate and communicate with your church. Okay.
I've been doing that to the point. Hey, we can overcome the flesh by denying the flesh, and my goodness, by changing your diet, that's exactly what you're doing, because the flesh wants a whole lot of things out of that. The bread, the starches, the sweets.
Yeah.
All that right there, hey, it don't exist anymore.
Oh yeah.
And believe it or not, hey, flesh really wants, when I see it, I look. But hey, I'm not tempted by the eyes anymore.
Yeah. So it just comes down to realization and understanding that there is a monkey mind inside us. We just have to tell that monkey mind to sit in the corner and do understand what it's not about the food. It's about what our body does to the food that we eat. That is very important.
Exactly.
Thank you for the interview.
Thank you.
Take care.
So basically, as you can see this, it just comes down to us empowering our patients to really do the real aspect of care process. And there is stronger evidence nowadays for diabetes remission. So this is a particularly the word remission, whereas reversal is gives a connotation of completely gone. But when we tell that it is in remission, then we can make them assured that, okay, they have to understand that it is a lifestyle. So for this remission to happen, this is a combination of diabetes and obesity, you say. And all we have to do is around people losing substantially in obese patients, losing up to about 15 kgs can safely make this possible. The sooner the better. It is very much a possibility. And even though there is not much for some people improvement, even if there is no improvement, then we can also show that there is reducing the medications. The cost of insulin is so high, and other medication costs are so high, and we can get better sugar levels and lesser additional complications. The sugar levels are very important because
the focus has to be on metabolic fitness. Weight loss may be just a good side effect. We have to understand that the diabesity, the combination of obesity and diabetes, also has underlying problems that affect other issues, including fatty liver, which we are working on a project to reverse fatty liver. And also, we are going to be offering solutions, including fibroscan for that. And obviously, PCOS, polycystic ovarian syndrome, is a huge problem. Lipedema and lymphedema is a huge thing that I, as a wound care professional, see this. And even in diabetes type 1, there is double diabetes when we are increasing the dose of the insulin. Obviously, we focus on metabolic syndrome, and in our practice, we have a lot of cardiac patients. But as an infectious disease doctor, what I want to stress is that infectious disease outcomes are remarkably improved when metabolic matters are taken and controlled better. Like we see significant improvement in patients who have COVID outcomes. That's a whole another topic. So there was recently a consensus report regarding diabetes remission terminology for improvement, which shows that in patients, remission is defined as hemoglobin A1c of 6.5% without any medications for 3 months or more. And in people who use continuous glucose monitor, it could be hemoglobin A1c, that is calculated hemoglobin A1c of 6.5 there too. And obviously, this has to be a 3-month period. Now, what we are facing right now is a twindemic of diabetes and obesity and chronic disease tsunami. And we need a comprehensive approach to really improve this. And hopefully, through this educational offering, we are hoping to empower more providers and also, in fact, empower patients and to help them understand themselves. Thank you very much, and hope this was of help.